So today is Africa Day. We celebrate our wonderful continent, but at a very difficult time. Globally, we're still recovering from the worst of the COVID-19 pandemic. We see that climate change is affecting many communities. And of course, there's concern about global food shortages, in part because of climate change, also because of what we're seeing in Ukraine with the war affecting supply chains. There's particular concern for children in the Horn of Africa. Unicef is the UN's children's agency, and I'm joined now by Dr Félicité Tchibindat. She's the Deputy Regional Officer for West and Central Africa. Doctor, thank you so much for your time. On Africa Day, I think it's important we talk about concerns for children around food supply. Obviously, the adults are affected as well. And am I correct that your major concern is over the drought in the Horn of Africa? Could you talk to us about the food supply situation there and just how bad the drought is and whether it's going to worsen?
Yeah, thank you so much for having me. I'm here in Malabo, where we are having the African Union Humanitarian Summit. Horn of Africa, it's where we have the biggest number in terms of population affected by drought. But we have also in the west part of Africa, we have the Sahel, which is the second hotspot. And then we have other areas that are affected by conflict, affected like Republic of Congo, Democratic Republic of Congo, and Central African Republic, and down south, Mozambique and Madagascar. So we have 4 hotspots in Africa. I mean, the one with the biggest number is obviously Horn of Africa. The second one is a Sahel. And the situation is quite serious because half of the population that is affected are children. And children are the most vulnerable to the climate change, to the conflict. And now we see with the Ukraine, we can see that there is an increase in the food prices that is disrupting the food supply chain. We have also the fuel, which is also improving. A lot of countries are relying on food imports, so it means that the food is going to be much more expensive. It's really the price are rocketing in part of Africa. And this has an impact on children, especially those who are already, we have seen before, we have like 1 million of children that's in the Central Sahel affected by malnutrition. And when we have the disruption of the supply chain, we see that the cost of the product that we use, like ready-to-use therapeutic food, has increased, it's planned to increase by 16%, meaning that 600,000 children that were supposed to receive this life-saving treatment will not be able to receive because of the increasing price.
I mean, it's a perfect storm of different issues coming together to create a massive food crisis. And just on children, as you said, children make up over half. But so I suppose we can double these numbers. But in your press release, you're saying 1.2 million children will face severe wasting this year in the DRC alone. Ethiopia, 1.2, northern Nigeria, over 600,000, Niger, nearly 500,000 children. I mean, and the list goes on. You're calling
for households have access to a social safety net so that they can be able to buy the nutritious food. But it's not only about food when we talk about nutrition. It's also about water, sanitation, and hygiene. This is important. We say that we have water scarcity in our region. One of the area which we call the Lake Chad is losing, and the Lake Chad is really providing, for instance, water for 40 million. And now it's drying up. It means that those population will not have access to water. And we also have to look at health. What we are really playing is that the essential commodity that is needed, food, health, water, is really seen as a public good, and government, African government, should really invest. We know that the humanitarian assistance in terms of resources is going down, and if we are able to really invest domestic resources, we will have we will be able to address the issue in a more sustainable way, because it's not just about having humanitarian assistance. It's needed, but we need really to invest. Having this humanitarian development together is the key. And the key is also that the community are empowered to be able to take care of their children, of the family. So this is really a more multi-sectoral approach that will really help to anticipate, prevent, and reduce the number of children that are severely malnourished.
Yeah, it's staggering numbers of children at risk of malnourishment. As you've explained, it's climate change, which is worsening droughts in various regions. It's the Ukraine war, which of course is just messing with supply chains, pushing up the price of food and fuel. And COVID, of course, as well. So, Dr Félicité Tchibindat, thank you so much for bringing us a very realistic, albeit distressing picture for this Africa Day. The doctor is UNICEF's Deputy Regional Officer for West and Central Africa.